Okay, welcome to your psychology phobias, your psychopathology phobias revision. This is the first part of the lesson. There will be a second part as well, where we'll be talking about the treatments. So, phobias. Definition. The definition of a phobia is an irrational fear of an object or a situation. And it's important that you remember that it's the irrational part of it here. It's not a kind of normal fear that is people would have. It's this irrational fear that's excessive, and it's out of proportion to any real danger presented by the phobic stimulus. So here's a few examples of what a normal fear is compared to what phobia is. So a normal fear would be feeling anxious when you're flying through turbulence or taking off, or during a storm. But a phobia would be not going to your best friend's island wedding because you'd have to fly there. So it's this excessive fear that's stopping you from living your life normally. A normal fear, experiencing butterflies when peering down from the top of a skyscraper, is normal. But a phobia of heights would be involve you turning down a great job because it's on the 10th floor of the office building. So this fear is excessive and it's affecting your life. Getting nervous when you see a pit bull or a Rottweiler is normal, but a phobia would be when you don't go anywhere near a park because you might see a dog. Again, affecting your life. Excessive fear. And a normal fear, feeling a little queasy when you get a shot, get an injection, or when you're having a blood test. But a phobia would be avoiding necessary medical treatment or doctor's checkups because you're scared of needles. So completely avoiding any kind of treatment because you're scared of needles that actually is probably going to make you more ill in the long run. That is the phobia. Okay, so the DSM-5 categories of phobias. We've got 3 categories of phobias: specific phobia, social anxiety, social phobia, and agoraphobia. So we've got our specific phobia of an object, e.g. an animal or a body part or a situation. So a specific phobia. So there's my little example, my little spider. That is your specific phobia, something that you can say, I'm scared of this particular thing. A social anxiety or a social phobia is the phobia of a social situation. So here's my example of that. Public speaking, using a public toilet, meeting new people, any phobia where you're scared of being around and interacting with other people in society. And agoraphobia is the phobia of being outside or in a public place. So here's my example of, or my picture of this poor chap who's stuck inside his house. He's scared of going outside, scared of being in a public place. So here's some examples of specific phobias. Some you will maybe recognize. You may be asked to give an example of a specific phobia. So here are a few you might be able to try and remember. So we've got arachnophobia, our fear of spiders. We've got ophidiophobia, the fear of snakes. Coulrophobia, fear of clowns. Kinematophobia, fear of zombies. Omphalophobia, fear of belly buttons, very scary belly button over there. Rectophobia, the fear of bottoms, you can remember that one quite easily, rectum. Nomophobia, that's the fear of being without a phone, and this one's quite easy to remember because it was made up, this name, and it comes from no mobile phone phobia, nomophobia. So the fear of being without a phone, or fear of having no phone signal or no battery or whatever. Apparently it's growing, this phobia. It's becoming quite a big phobia. People are anxious about how they can live without a phone. Pogonophobia is the fear of beards. And alpha-butyrophobia, that sounds a bit weird, is the fear of peanut butter. So have a couple that you memorize, and you can not only hopefully answer the questions in your exam well, but you can dazzle your friends with your knowledge of phobias. So we've got the different characteristics of phobias. So we need to talk about behavioural characteristics first of all, and this is the way that we respond to things or situations we fear by behaving in particular ways. So this is what we can physically see somebody doing, their actual behaviour, and the question is, how do we respond to that fear in terms of what we actually do? Do we run around, panic, scream, all the rest of it? So these are our 3 behavioural characteristics. We've got panic, there he is, panicking. We've got avoidance, there he is, hiding behind a rock. And we've got endurance, just taking it, just holding on, just bearing it. So panic, screaming, crying, or running away. Children could be clingy or freeze or have a tantrum. So that's our first behavioural characteristic, panic. Avoidance, so people basically making a great big effort to avoid coming into contact with a phobic stimulus, can make it hard to go about everyday life if you are avoiding your phobic stimulus. So for example, if you've got a fear of public toilets, then you're going to be scared to go anywhere for any period of time when you might need to go to the loo, so you stick around home. And that obviously can interfere with your work, your education, your social life. If you're scared to think, if I need to go to the toilet, where am I going to go? Because I'm scared of public toilets. So avoidance is a behavioural characteristic. And endurance is the third one, which was our picture of the man holding on, just enduring this pain. So sufferers remaining in presence of the phobic stimulus, but continuing to experience these high levels of anxiety. So they just still feel that anxiety, but remain in the presence of the phobic stimulus because they can't get away from it for whatever reason. So those behavioural characteristics, things that we can physically see somebody doing. Emotional characteristics, these are the ones that you are feeling. Okay, it's not what you're thinking, but it's your actual feelings that you can't change. So the 2 main emotional characteristics of phobias are anxiety and fear. So what is the difference between anxiety and fear? Well, anxiety is an unpleasant state of high arousal, an inability to relax and feel positive about a situation. Anxiety can be an ongoing thing, can be a long thing. So here's our picture of somebody with anxiety, this general feeling of not being able to relax, of just this horrible kind of feeling of high arousal the whole time. But a fear as an emotion is different, because fear is a more short-lived thing. Fear is a very strong emotional response directed at a particular thing. So this is my example of somebody who has fear rather than anxiety. Fear is something that can't last for a long time. Anxiety can last for a long time. Fear is this strong reaction to the specific thing. So here we have an example of emotional characteristics. So Matt has arachnophobia, fear of spiders, do you remember? He'll feel anxiety when he thinks about being in a situation in which he may encounter a spider. So the thought of going down into his shed, he will be feeling nervous about that. He'll be having that kind of anxious feeling, that high arousal feeling, because he thinks that there's a really good chance that he could see a spider, or he's got to go and get something from the back of the cupboard that quite often there's some spiders in there. It'll be that anxious feeling that he'll be feeling inside. And it'll be when he actually sees the spider itself, that he will have that strong emotion of fear towards the spider. So the anxiety is kind of the what if, and then the fear is the, oh, there it is, it's happened, and you can direct that fear towards a specific thing that you're seeing. Emotional responses are unreasonable. So Matt's fear of spiders involves a really strong emotional response to a tiny harmless spider, which is disproportionate to the danger posed by any spider Matt is likely to come across. So it's important to remember that the emotional responses are much stronger than they should be, and that's why it can be very difficult when you have a phobia, because you know that there's no reason to be behaving that way, but you can't help it. It's those emotional feelings that you can't control. Cognitive characteristics of phobias concern the way which people think and process the information. So cognition is all about thinking, and these are obviously the thoughts people are having. People with phobias process information about phobic stimuli differently from other objects or stimuli. So there's a different process going on with those things that they're scared of, they're phobic of, compared to other things that they may encounter. So what are the characteristics? Well, we've got 3 here. Selective attention to the stimuli. So if a sufferer can see the stimuli, they will find it hard to look away from it. Keeping our eye on something dangerous gives us the best chance to react quickly to that threat. But it isn't helpful when the fear is irrational. So a pogonophobic will struggle to concentrate on what they're doing if there's someone with a beard in the room. So if this chap walks into the room and you are pogonophobic, all you'll be able to do is just be looking at his beard. You wouldn't be able to take your eyes off it because you just have this selective attention to the phobic stimulus, and you can't concentrate on anything else. And yes, that's quite helpful if it's a snake or something that could bite you, and you need to keep an eye on where it is so that you can make sure that you're out of the way of it. But like it gives this example, it's not particularly helpful when it's something that's really not going to harm you, like a beard. It's just going to cause you problems if you can't focus on anything other than that in the room. So that's the selective attention to the stimuli. Irrational beliefs is the next cognitive characteristic. So a phobic may believe irrational things, such as a social phobic might think, I must always sound intelligent. So they must think, oh, I can't possibly go in and speak in public because I have to sound intelligent the whole time, and I can't possibly risk going and not sounding intelligent. Or another irrational belief, somebody might have a belief that if they see a spider, the spider's going to come running and try and go into their mouth, or going to try and crawl into their hair or something. So they have these irrational beliefs about the phobic stimulus. Cognitive distortions are when your perceptions of something may be distorted. So, for example, you might think that if you've got a fear of belly buttons, you might think that belly buttons are absolutely disgusting. Or every time you see a snake, you might think that they are really violent and aggressive, even a little cute one like this. Okay, so how does behavioural psychology explain phobias? Well, classical conditioning is the key behavioural explanation of phobias, how we acquire phobias. So we just have a little recap of what classical conditioning is. So we've got the unconditional stimulus, which is the thing that initially causes the body's innate reaction. Then we've got the unconditioned response, which is the body's innate reaction. In this case, when we talk about phobias, it's going to be about fear. Okay. Then we've got a neutral stimulus, which is something that's unrelated, that's presented at the same time as the unconditioned stimulus. It becomes associated, and we associate the two stimuli, learning that the neutral stimulus produces the response. So by presenting the unconditional stimulus and the neutral stimulus at the same time, we associate the two together, and we learn and become conditioned to have the same response. So the neutral stimulus becomes the conditioned stimulus because we've conditioned ourselves to associate it with this, and the unconditioned response becomes the conditioned response because now that we've learnt to associate the neutral stimulus with the unconditioned stimulus, and the neutral stimulus has become the conditioned stimulus, our response has become our conditioned response. So the two-process model is something you could be asked about. Maurer, 1947, came up with it. So the two-process model has obviously got two processes involved. The first one is about how phobias are acquired, and that's to do with classical conditioning. And the second one that we'll come on to in a minute is how phobias are maintained, which is operant conditioning. So we'll talk about that in a second. So here we have again our little example of the unconditioned stimulus and the unconditioned response. So then the unconditioned stimulus and the neutral stimulus becomes the unconditioned response, okay? And then we pair them together first of all, and then once we start associating and learning, the neutral stimulus then becomes the conditioned stimulus, and the unconditioned response becomes the conditioned response. The neutral stimulus becomes a conditioned stimulus because you've learnt that association with it, with the unconditioned stimulus that you're afraid of. And one word to be careful of here is generalization. You have to remember about generalization because it can occur when you fear other objects or situations that are similar to the phobic stimulus. So example here would be little Albert, who was conditioned to be scared of white rabbits or white rats, depending on which which of the papers you read, and he actually then became scared. He had this generalization that occurred because he then became scared of all white fluffy things, including when Watson dressed as Father Christmas. He had his white beard, and poor little Albert was scared of him. So this is an example to show us how phobias were actually are acquired. So we've got phobia of dogs here. So an unconditioned stimulus might have been a dog bite. It might have been witnessing somebody you love scared of a dog, or it might have been witness someone get hurt by a dog. So the unconditioned response with any of these things would be pain or fear. Well, pain and fear kind of almost go together, really, don't they? So actually, it was the seeing somebody scared, seeing somebody hurt, being hurt yourself. The normal reaction is that you would feel fear. Now, the neutral stimulus in this that has become paired with it is the dog. Each time it was the dog bite, it was seeing somebody scared of the dog, it was witnessing somebody get hurt by a dog. So the neutral stimulus has become associated with the unconditioned stimulus. So now the neutral stimulus has become the conditioned stimulus, which is now the dog, and the conditioned response, therefore, now is the fear. And that's how we have developed this phobia of dogs. Here's an example of a phobia of public speaking, how we can use classical conditioning to explain that. So the unconditioned stimulus might have been that you may have been laughed at for saying something wrong in public. You might have witnessed somebody you love being scared of speaking in public. You might have seen somebody else be embarrassed publicly. And the unconditioned response of any of those things would be that feeling of shame, embarrassment, and fear of having that feeling of shame and embarrassment. So the neutral stimulus here that comes with all of these is the public speaking. So the fact that you've said something wrong out loud publicly, the public speaking. Witnessing someone you love being scared of speaking in public, being embarrassed publicly. So this neutral stimulus of the public speaking is being paired with the unconditioned stimulus here, okay, of being laughed at and what have you. And the feeling and the response to that is that feeling of shame and embarrassment and fear. So now the conditioned stimulus, once these two have been paired together, is the public speaking. And the conditioned response is that fear of feeling ashamed or embarrassed. Okay, so that's how that phobia has then become acquired. Is a little example of it with little Albert. So our neutral stimulus was the white rat. Little Albert didn't have any problem with that to begin with. Then Watson and Rayner made a loud noise, the unconditioned stimulus. And the fear response, the unconditioned response, is what is a normal response for somebody to bang something loudly just behind your head. It's going to make you scared, it's going to make you jump, and that's that innate response, that fear. So then he paired the unconditioned stimulus, which was the loud bang, and the neutral stimulus, which was the white rat, and we still had that same fear response. And then he found that the neutral stimulus, the white rat, actually became the conditioned stimulus, because then as soon as he learnt to pair these two in his mind, so that the white rat, the conditioned stimulus, produced this conditioned response, this fear response. Hopefully that all is clear for you. So the two process model, as I said, we've talked about classical conditioning being the explanation of the acquisition of our phobia, but it can't explain why our phobias do not decay over time. For example, it's unlikely you're going to be bitten by every dog you encounter, and therefore it would be reasonable to assume that our phobia should weaken with every friendly dog we come across. So every little dog like this should make you think, actually, I'm seeing more and more dogs that are friendly, so therefore my phobia is going to weaken. I'm going to become less scared of dogs. However, most phobias are long-term, and according to Maurer, our phobias are maintained through our operant conditioning. So that's our second process, operant conditioning, maintaining the phobia. So that is process 2. And here in operant conditioning, this is what operant conditioning is reward and punishment, you'll remember. So behaviours are strengthened through reinforcement, through negative reinforcement in this case. Okay, so if a person with a phobia of dogs sees a dog whilst out walking, they might try to avoid the dog by crossing over the road. So the avoidance reduces the person's feelings of anxiety, so it takes away something bad and negatively reinforces their behaviour. So it makes it more likely that that person is going to repeat that behaviour again, i.e. it's going to stop going anywhere near a dog, it's going to avoid a dog. So as a result, a person will continue to avoid dogs and maintain their phobia. So remember, negative reinforcement is taking something bad away to keep on making you do that same behaviour. So here, obviously, if we avoid the phobia, it's taking that bad thing away and it's making us feel a bit better. So therefore, we're going to keep doing that avoidance and it keeps strengthening our phobia. Okay. So a quick bit about evaluation, our peel points, and then we'll be finished with this part of the lesson. So here are 4 peel points for you. We'll just quickly zoom through them. So we're evaluating the 2-process model here. So the first peel point is about how useful it is and how its application is used in everyday life, or how it's applied in everyday life. And actually this is very, very useful, this 2-process model. It's a real positive to this, because not only does it explain how phobias are acquired, but it also explains how they're maintained. And this is something that's really helpful for therapy, because it explains why patients need to be exposed to the phobic stimulus so that their avoidance behaviour doesn't reinforce a phobia. So that's a real strength of the 2-process model. It's helped us to really create some very good therapies to help people to get over their phobia and to stop behaving in a way that's going to reinforce their phobia, i.e. the negative reinforcement of the avoidance. So that's first peel point. Second peel point is that there's good research evidence that supports it can be acquired through classical conditioning. So we've got little Albert, his Watson and Rayner's study that you know well, that we've just recapped, and it very clearly shows that classical conditioning can be used to acquire a phobia, and it provides clear support for classical conditioning's role in phobia acquisition. So we've got some good research evidence to support it. But a couple of negatives. It's there is a limitation in its explanation of phobias, this 2-process model, because it doesn't really explain why some phobias are more common than others, particularly things that were dangerous in our evolutionary past, so things like spiders and snakes and heights and things like that. Oh, it's got that example there. So for example, people are more likely to be afraid of snakes, spiders or heights, even though they haven't had bad experiences of these before. So you could have a fear of a spider, but you could have had no experience, a bad experience of spiders ever, but have a phobia of them. And Seligman said that this is due to biological preparedness. He believes that we are evolutionary. Our evolution has meant that we have evolved to be scared of things that we should be afraid of, and we are biologically, innately born prepared to be afraid of these things that could potentially harm us. So therefore, this 2-process model, it ignores the evolutionary explanation that we are biologically prepared to fear things that could threaten our survival, and therefore it shows that there is more to acquiring phobias than just the conditioning. So it's just something that we think this 2-process model doesn't explain everything. And the last peel point is that it doesn't explain why all bad experiences don't lead to phobias. So some phobias appear after bad experiences. Some appear without any obvious bad experience. So for example, some people might have a fear of buttons or something, but have had actually no bad experience of it. So Dinardo et al., he found that over half of people who had been bitten by a dog do not develop a phobia. If this 2-process model was always true and always accurate, it should be that every single person that's had a bad experience with a dog should develop a phobia of a dog, but over half of people that have been bitten by a dog do not. And this shows that conditioning alone cannot account for all phobias. perhaps maybe only where a vulnerability exists. So perhaps only where somebody has vulnerability to develop a phobia would they then go on to develop a phobia. So those are the evaluation points. And that's it for part 1 of this lesson. Look out for part 2, where we'll be talking about treatments. And yeah, I hope you found it of use.